morning, my name is Andres Lalaine Bonifacio and I will be your nurse for today. So, I will demonstrate the bag technique that we are going to conduct when we are in our community health nursing. First, we will ask our client if there are any tables that available that we can put our bag and our articles. And then, if the table is not provided, we're gonna put first our plastic lining and our paper lining. First is the plastic lining. Make sure that the bare surface or the outer surface of the table will have a contact into the inner surface of the plastic lining. And now that we have put it in right here on the surface of the table, we will now get our paper lining. Within the same procedure, I will put the inner surface of the paper lining into the outer surface of the plastic lining. And now that we have put it in right there, we can now put our bag on this side. After that, we're gonna ask the client if there are any available sink and a running water that we can wash our hands. If there are not, we can also use a basin with the water in it, and then we can also wash our hands. If it is confirmed that there are water or there are kitchen basin, now we can now perform our hand hygiene. I'll now get the soap and the towel in my bag and put it right here. And now, I will now close the bag so that the articles are not exposed to the air as we conduct our hand hygiene. So I will now get the towel and the soap, and I will gonna be back after I have washed my hands. So after I have performed hand hygiene, I'm gonna put it right here on the side. And then next is we're gonna put the apron. So make sure that the inner surface will have a contact in our clothes. And then the outer surface of the apron will have a contact in the outer surface. This will help us be clean and safe from the microorganisms attaching to our skin. So make sure that we have put it make sure that the outer surface and the inner surface is in contact with our skin or in our clothes. And after that, we are gonna get the articles that we are needing. So we can also perform other nursing care to our clients, such as perineal care, fundic height measurement, or to measure the height and weight of the children in the household. In my case, I will perform wound care to my patient as a wound and an injury. So I will get the articles right now and put it right here. There are also gloves. It is necessary to use gloves. We can also use gloves. So now that the articles are prepared, we can now perform our wound care to our patient. And now that the procedure is done, we can now clean the articles. And then the gloves that had been used, we make sure to dispose it to the trash bin or the trash can. And all that the cotton balls or the gloves that had been used are contaminated, we can also put it in the trash. Don't forget to put it in the trash. Then this we cannot put it in the paper receptacle. can now also try to put it on the trash bin or trash can, because this is considered to be contaminated with microorganisms. And now, we can now put the articles back onto the bag. And now, after that, we will go again to the sink to wash our hands. After we wash our hands, we can now put the soap inside the bag. Towel is stuck, we can put it in a separate plastic. And after that, we will now going to remove the apron. So make sure that in removing the apron and unfolding it, make sure that the outside surface that had contact with the rounding as we performed our wound care inside. We will now put it inside the bag. After that, we're gonna get our bag. So since the surface of the paper lining, so we will now fold it. This part will gonna be in the inside, folded inside. And put it in the bag. So since the plastic lining is contacted with a table, fish that have been in contact with the table should be folded inside. And now we are done. And after that, we were gonna document nursing procedure. We can also refer for nursing care, and then the client's response, and the time and the date. Also give our nursing referral. The procedure is all done.